Okay, we're going to be demonstrating how to do a fentanyl patch. So I have already been at the nurse's station. I've done my verification that my MAR was correct to my doctor's orders. Then I went to the med room and I did my first 2 checks on my medication. And so now I'm coming into the patient's room. And so knock, knock, knock. Good morning. My name is Jan Bucks-Kemper. I'm a registered nurse. And we're going to be doing some medications this morning. But before we get started with that, let me pull up your chart. Okay? And can you tell me your name and date of birth? Smith Brad, 4/24/1957. Smith Brad, 4/24/1957. Okay, and I'm going to scan. And then, Mr. Smith, are you allergic to any kind of medications? Codeine, and we've got codeine, all right. And so your scan bag matches that. What does codeine do to you? Okay, this really makes you feel crazy. Okay, well, we're not going to be doing any codeine today, but I've got a patch, your medication patch, that's going to help with pain. So I'm going to do my 3rd check real quick, and then I'll talk to you about it, and then we'll do some assessments for that, okay? All right, so I have got Smith Brad, date of birth 4/24/1957. I've got fentanyl patch, 25 micrograms per hour, transdermal patch every 3 days, and this is my 9 o'clock dose. In my hand, I've got fentanyl transdermal patch. It's 25 micrograms per hour, so that matches. Expiration date's 1/2/2028, and my package is intact, okay? So that's my 3rd check. I'm putting my scan right there. And I scanned my medication, okay? So we've done our 3rd check, and like I said, I'm giving the 9 o'clock dose this morning. So, Mr. Smith, this transdermal, fentanyl transdermal patch, this is an opioid analgesic, and so it can make you feel dizzy, it can kind of confusion, it can cause you to have some constipation, but it's to help with your pain medication. So on a pain scale of 0 to 10, 0 being no pain, 10 being the most pain, what would you consider your pain? A 0? Okay. So hopefully that means that this is working, and every 3 days we'll change that patch out, okay? And if you did have any pain, then we would do Caldera, which is characteristics, onset, location, duration, exacerbation, radiation, release, and then any associated signs and symptoms. But you don't have any of those. So, and then since it can make you kind of have constipation, when was your last bowel movement? It was this morning, okay, and can you describe it to me? It was soft and formed, okay, and easily passed, okay, so that's good. The other thing that this can do is it can cause your blood pressure and pulse and to go down. So we're going to go ahead and do a set of vital signs real quick while we are, before we do this. So I'm going to get the blood pressure, make sure it's the right size blood pressure cuff. And then you know what your blood pressure normally runs, okay? 120s and the 80s, okay, all right. Okay, this is going to get tight. Get it where I can see eye level here. There we go. Okay. 120 over 82. So that kind of gives us a baseline. And then I'm going to need to do your pulse and respirations. And so I'm going to put your hand over here on the side, on your arm here. So it'll be across your chest right here. And we're going to do your pulse and respirations. Let me get to my second hand. Okay. Okay, so I'm going to go ahead and document that right quick. So my blood pressure was 120 over 82. Pulse was 80. And then my respirations were 14. Okay? All right, so that's good. We've got a baseline of where we were started, because this kind of can make you sedated. It can decrease your blood pressure, decrease your pulse. But you can't drink any grapefruit with this. You don't like grapefruit? Okay, so we don't have to worry about that. Okay, well, with this, I'm going to check to make sure when this started, because it's every 3 days. And so I need to make sure that we're on the third day, or is this the first one that you are getting? And if you've already had this and this is our third day, then we would need to find out where the last patch was. I can ask you, or I can look in the chart, because I would have documented where it was, okay? Okay, so it looks like there was one right here. So I've checked the date on there, and of course it says in this is our third day. So we're going to go ahead and take that off. We're going to add, per policy and procedure, we're going to put the sticky side together. Okay, so we've got the sticky side together, and according to policy, we've got to put this in our glove. And then I'm going to take this back to the medication room. Because there's a special place that we have to dispose of any patches that we have taken off, because this is a opioid analgesic, okay, for your pain. And so I'm going to check that area that I just took that off, and then I'm going to go ahead and get another pair of gloves on. So we're checking for the site to see the site to see if there was any redness or anything like that, and I don't see any. And so I'm going to go ahead and put my gloves on, and we're going to clean that site, okay? So I'm going to soap and just, cleanse it with soap and water, dry it good. and then I'm going to look for another spot. And typically you want to do the upper chest, you could do even the upper back a lot of times, on the abdomen and the lower abdomen, and even on the back side of your top part of your buttocks. You typically don't want to do anything below the elbows or below the knees, okay? And so since we took it off there, we're going to look here. We're going to make sure that there's not any hair on there, because if there was hair, then the medication is not going to stick there. So we've got a clean, dry area here, no hair there. And I'm going to clean it off good, make sure clean and dry. And then we're going to go ahead and take out our patch. Okay. I'm wearing gloves because I do not want my skin to absorb this, and so I'm going to take the little plastic off, okay? So I've taken that plastic off, and we're going to stick it right here on here, and I'm going to use the palm of my hand because it's warm, just to kind of seal it on there, okay? So we've got it sealed on there, and I don't want to write on the patch itself, so I'm going to take a piece of paper or some tape, and I'm going to document the date, and today is the, okay, and the time. And then I'm going to put my initials, so if anybody has any questions. And then I'm going to put that right beside or right across, just on the side of it right here. That way whoever sees that can see the last, when it was put on, and know when that 3 days is going to be up, okay? And so we just got to be careful when we're taking a bath that we'll just kind of wash around that. You don't want to, that to come off, okay? And so glove to glove, skin to skin. I'm going to do a medical hand wash. And like I said, I've got that medication in that glove, and we'll take that back to the nurse's station whenever we get ready to leave. So I'm going to go ahead, are you doing okay? I'm going to go ahead and put your bed down. Okay, so I've already put your vital signs in here. I didn't do a very good job of okay, also I need to put your pain level. And you said it was a 0, okay? I need to put on here that I removed old patch from the right shoulder, right anterior shoulder. And then I also need to put that I placed the new patch on the left up anterior shoulder, old right anterior, actually it was upper chest, not shoulder, okay? And then place the new one on the left upper anterior chest. That way they know that I removed the other one, and that where we put the new one, so the person coming in will know where to look. And then I need to initial my JB. That shows that I'm the one that gave that medication. And then I need to come down and I need to sign. So I need to put my J, Buck Skipper, my credentials, and then I need to put my initials. That way, if anybody has any questions, they know JB is the one that did it, and JB, and then they'll know that Jambucks can persuade who to come and contact if there's any problems on that. So I did my vital signs, the pain, I documented that I removed the old one, and then where I actually put the new one, okay, so that anybody can find that out. Okay, so once I finished that, I've got all my documentation done, I've signed my chart, then I'm going to go ahead and close that down. And I've got the bed in the lowest position, side rails up ×2, and the call light is right here, the wheels are locked. Is there anything else I can do for you before I leave? Okay, no? Okay, well, you've got everything right here. Just remember to call before you get up, because this can make you drowsy and we don't want you falling, okay? So you know where the call light is, and we'll get you that armband, we'll get you the yellow gown, we'll get you the non-skid socks, and we're gonna get a sign up there, okay? Any questions? Okay, well, you have a good day. All right, and call me if you need anything, and I'll be back in about 30 minutes to check on you to make sure you're not having any problems or anything like that. Okay, all right, thank you. And I'll leave the patient's room.